I am called Elly Aniku. I come from Uganda. I was a gynecologist in my country. I got to know about this training first, I think, through the media, and about this particular training, I was encountered by one of the ministers of health who had visited our hospital and indicated that there was need for us to get somebody who can be able to undertake a training in embryology, and she wanted somebody who is interested in doing the embryology, because we had explained to her that our hospital, we are unable to do artificial reproduction technology because we have a gap. We do not have embryologists in our hospital, and yet we have other cadres who will be able to help in offering assisted reproductive technology. So that's how I got to know about this program. So the field of embryology is very important because we have been seeing patients who have challenges with the infertility problem, but we were unable to continue. There are those who definitely need other advanced embryology techniques like in vitro fertilization, intracytoplasmic sperm injection, but we did not have competent people who were able to do that. So I think the knowledge I've acquired here would be able to ensure that we should be able to offer those other services which which we're unable to offer to clients, so that they can be able to have a baby, because there are times when we can diagnose their problem, but we are unable to have a solution to their problem. So I think this training is going to help us give them a complete package of services with respect to their need to have children, and that is to the patient and to the country, and I think Ministry of Health. The fertility issues have a lot of challenges because one, infertility is there's a lot of stigma, and in most cases it is the women who tend to be blamed, or who bear the responsibility of not having a child in a family. So it is a very stressing thing to couple. They feel uncomfortable, especially in countries like ours, which has a high fertility rate. Actually, you find other people are producing, but if you don't have a child, it is a very distressing experience to very many couples. With respect to services, as I mentioned earlier, there is no government facility or institutions that offer free services fertility services to people. We've got a few artificial reproductive technology clinics. They are all located in one place. They are located all within the capital city, and they are extremely very costly, and the common people are unable to, they cannot afford it. And then also, as I told you before, the embryologists, for example, in my hospital, there was any single embryologist who was trained before, and because of that, even when you have the equipment, you cannot be able to do the other aspects, technical aspects of laboratory work, so that you can be able to make people to have babies. So it is true, there are very few embryologists in the country. Also, other fertility, the fertility experts in other aspects, the clinicians, there are not so many per se. Male infertility is very common in my country, but men usually do not believe that they can have fertility problems. and because of that, they do not come for healthcare services as women do. And I usually find it very difficult at times in infertility. You find both the man and the woman are involved, but it's very difficult for us to usually integrate men into fertility care services. And yet they're very important. Even if male infertility is not the issue, they need to give support to their female partners who have infertility issue. So men have, I think, a negative perception that they cannot get infertile, and that makes it very difficult for the healthcare workers to be able to help the couple, because even if the problem is with a woman, you need both people so that you can be able to solve the issue. My expectation, I think we covered everything I was expecting to learn, and probably we learned more, a little bit more than what I'd expected, because initially I thought the training time was short. I would be able to learn very few things, but I was very impressed by the training module in Manipal here. The trainers, the professors were very close, so we learned actually much more than what I'd anticipated to learn. I would want to, in a very special way, give thanks to Merck Foundation for offering this training opportunity. It is a very rare opportunity, and it's not easy to be able to get sponsorship for very good trainings like this. Uganda,